Okay. Again, good afternoon. I'm Bethany Hamilton, co-director of the National Center for Medical Legal Partnership. You are joining us today, October 11, 2022 at 1 p.m. We're going to be online for about 90 minutes for today's 1 p.m. Eastern time, excuse me. We're going to be online for about 90 minutes for today's webinar. Today we are covering a very important topic that we hope will take medical legal partnership and this movement into a new advanced space. So we'll be talking more about how health centers and justice systems can collaborate to improve mental or behavioral health. I just want to make a quick note here about the title, the verbiage that we utilized. Although the title is specifically calling out mental health, we know that that is a subset of behavioral health, and mental health and substance use disorders are included in the content that we are discussing in the issue brief. That is the foundation for this webinar. So if you'd like, you can, in your mind, change that phrase mental health to behavioral health because we are addressing the broader topic. Let's go to the next slide. Thank you. So today's webinar is funded by HRSA, the Health Resources and Services Administration. The National Center for Medical Legal Partnership actually is a national training and technical assistance partner, providing TTA and resources now in our 9th year of doing so for health centers and their medical legal partnerships around the country, including those who are newly in this space and want to develop and implement a medical legal partnership. We want to thank HRSA as well as some additional partners for their contributions. Let's go to the next slide. Quick housekeeping before I go to the contributions. If you need any assistance, please feel free to utilize either Q&A or chat. And we have several National Center for Medical Legal Partnership staff who are on. You'll be able to select, I think, host and panelist, or type in the chat that you need help, or utilize the Q&A to let us know you need some assistance. But we do have Danielle Rahajison and Catherine Stinton of the National Center online here on Zoom to help. If you need some other assistance, or if you have a colleague that needs help and isn't online, email us at ncmlp@gwu.edu for assistance. Please try to use the Q&A pane in Zoom if you have questions. That's where we will be directing most of our attention when it comes to the Q&A portion of the event. Don't hold on to your questions until the end. Type them in the Q&A as they come up, as they arise, because we'll be keeping an eye on that as we proceed with the main panelist presentations. If you do need to, you can activate the captions to allow for live transcripts. So click on live transcript and show subtitle to get closed captioning to show up on your Zoom platform. Let's go to the next slide. Thanks, Danielle. So for the acknowledgments that I mentioned before, we want to sincerely thank HRSA, the National Center for State Courts, Dr. James Teufel, who you see here on the screen, Shannon Mace, who's also here as one of our panelists, Patty Tobias, who's joining us here today as one of our panelists with NCSC, as well as all of the key informants for their work on this project. We know many of you took time out of your very busy schedules to be interviewed on a topic that hadn't been directly addressed and explored in this manner before. So we really want to thank you for helping our key authors here, our lead authors here, to write what was a massive issue brief and come up with some key recommendations to help you advance your work. However, what I also want to do is send out an especially important thanks to Attorney April Merrill, Director of the Medical Legal Partnerships at Legal Aid Services of Oklahoma, who really inspired this issue brief and this work. And she helped to amplify the voices of those of you in the legal aid community who are working to create health justice, achieve that health justice in your communities, and improve the health and well-being outcomes for those of you who support your communities through medical legal partnerships. So thank you, thank you, thank you to April Merrill. She's not able to join us today, of course, because of her work, but we do want to sincerely thank her for inspiring this work. Next slide. All right, we have two poll questions that we're going to run. So on your Zoom platform, you should now see that we have opened a poll. The first question is to get to know who you are. So tell us, Are you with a health center or federally qualified health center or lookalike? Are you with a certified community behavioral health program, CCBHCs? Are you with a community mental health center? Are you with a legal services organization? If you're with a law school and that's how you conduct or provide legal services, go ahead and click the box for legal services organization. Are you with a hospital, a primary care association, health center controlled network? Are you with the courts? Or are you in an other category? Go ahead and select who you are. Additionally, the second question that we are asking to get to know more about you is, are you a part of an MLP that currently engages in any capacity with courts or judges in your community? So the answer choices are yes, no, my MLP does not engage courts or judges. I am not a part of an MLP, or I don't know. So we'll leave this open for maybe 10 more seconds. And then Catherine will close out the poll to see what the results are coming in from our audience, because we have about 92% participation. See if a couple more people can respond, but that might be it capped out. Let's close that out, Catherine. All right, so hopefully the results are sharing for everyone on the screen. About 23% of our audience are from FQHCs. About 46% of you are representing legal services organizations. It's great to see that we actually have representation from community mental health centers, about 3%. Hospitals, PCAs, courts are represented here. And then we have a huge category of other. So this is where I'd welcome you all to use the chat and let us know if you checked off that other box. Let us know who you are and where you're from. And then for those of you who answered the second question, are you a part of an MLP that currently engages courts, judges, or judges in any capacity? About 34% of you said yes. 14% said no. 40% of you are not a part of an MLP. We hope you soon will be in some way as a result of these trainings. And then 11% of you said you're not sure, you don't know. So thank you all for participating. Again, be curious to know who the folks in the other category are. Just send us a chat in Zoom to let us know if you clicked off the other box where you're from. And thank you. All right, let's go to the next slide. Move a little quicker here. So for today's webinar event, we're hoping that you in the audience will increase your understanding of the link between healthcare and justice systems. Our panelists will help you explore further integration of and partnership between health centers, CCBHCs, and courts to better improve that continuum of behavioral or mental health care. And then we're hoping that you'll learn more about how to collaborate with courts to improve behavioral health access and mental health of your patient populations and justice-involved individuals. Let's go to the next slide. You know who I am. Again, I'm Bethany Hamilton, co-director of National Center for Medical Legal Partnership. But let me introduce you to our other panelists. Many of you may know, because she is a longtime MLP practitioner, Shannon Mace. Shannon Mace has more than 12 years of experience working at the intersection of public health, behavioral health, and poverty law to help improve systems for care for people and communities that are disproportionately impacted by systemic and structural harms. Currently, Shannon is executive director of the Health Education and Legal Assistance Project and MLP at Delaware Law School, so HELP MLP. Congratulations, Shannon. They serve families participating in maternal and child health home visiting programs in southeastern Pennsylvania. We're also happy to be joined by Dr. James Teufel. You also know his name very well. You've probably seen him on several of our past webinars. James Teufel is an independent consultant, now an expert in access to justice, the medical legal partnership approach. We often refer folks to him when it comes to MLP evaluation conversations and research, as well as because of his service in the health center world, even as a past board member, health center MLP implementation. James has served on the as president of the board of directors of community health centers, published peer-reviewed research on those topics of his MLP expertise and access to justice expertise. And he's actually supported the National Center, not just on our past webinars, but actually on various publications, including this issue brief that is the foundation of this webinar, and provided technical assistance needs related to MLP practice. You might see him on the Health Center MLP Toolkit as one of the co-authors of that publication as well. We are happy to also be joined by Patty Tobias. Patty is Principal Court Management Consultant for the National Center for State Court. She's been with NCSC's Court Consulting Services Division as the Principal Court Management Consultant since August of 2014. Patty has experience working in a wide variety of national, statewide, and local projects, including those that involve leadership and governance, case flow management, strategic planning, child welfare, criminal justice reform, and really improving the overall justice system response to mental health. She works with national court organizations and often presents at state and national conferences. So her name and face may look familiar to you all as well. As a part of the NCSC team, she currently supports the work of the National Judicial Task Force, which you'll hear a little bit more about, which work to examine the state court's role and response to mental illness. Thank you, Shannon, James, and Patty for joining us today. Let's move to the next slide. Why are we here? We know that individuals with mental health conditions are overrepresented in our criminal justice systems in particular. So you'll see on the slide, and this comes from our issue brief that we'll try to put a link to just to help people quickly access it and download it in the chat. But you'll see this graphic in our issue brief. 37% of people with a history of mental conditions are in our state and federal prisons. 44% of them are in local jails. 25% of people with severe psychological distress are in this criminal justice system here in the US. For those with substance use disorder, for our state and federal prisons, they represent 58% of that population, 63% in local jails, and 40% of the folks who are at the time of arrest are under the influence are in our justice systems. This is an overrepresentation, but something we can certainly fix. And so we have courts, MLPs, healthcare systems that are ready and willing and able to address this. And we're hoping that we can help you leverage those very limited resources to be able to partner and collaborate to better address the needs of these populations. Let's go to the next slide. Similarly, this is not just an opportunity to address these problems, right? So here's another graphic that shows that it is an imperative, right, upon us to really improve mental health care access and outcomes for individuals who have mental illness or are battling and recovering from opioid use disorder. This is also in our another graphic in our issue brief. I want to quickly just scroll, however, to our issue brief so that you all can hear from our panelists, not just about the data, but about how to get something done. So let's go to the next slide. What you'll hear from Shannon, James, and Patty today is what we covered in this issue brief. And I want to, again, thank the key informants for helping to inform this process. In the issue brief, Connecting Community Health Centers and Courts to Improve Behavioral Health of People and Communities, we walked through 9 recommendations to help health centers in particular and other healthcare providers learn how to collaborate with courts to better support the behavioral health of justice-involved people in particular. But we'd also ask everyone to please utilize the information in this issue brief to think beyond addressing the needs of justice-involved people, but think about that preventative legal advocacy that you can do with these recommendations. What can you do with these recommendations to actually prevent someone from becoming justice-involved in the first place? So James and Shannon are going to walk through those 9 recommendations in details, and then Patty will go through some information about how the task force, the National Judicial Task Force, worked on their own resolutions and action steps for their constituency. Ultimately, what we're hoping to do is bring healthcare providers into the legal context and expand the pool of potential legal services providers. So you'll hear a little bit more about that, and we'd be curious to hear from you what your questions are about implementing some of these recommendations. Let's go to the next slide. Without any further ado or delay, I'd like to pass the mic on to Shannon Mace, who you'll hear from first, and James Teufel to walk you through the 9 recommendations in the issue brief. Thank you, everyone.
Great. Thank you so much, Bethany. And hello, everyone. Thank you for joining us today to learn about such an incredibly important topic. Before we jump into the recommendations, I just wanted to take a quick minute to talk about our methods for the brief, and we can go to the next slide. So to inform this brief, Dr. Teufel and I conducted key informant interviews with 16 experts from 13 different states. And key informants represented people with both professional and personal lived experience. And our informants included a community health worker, health center leadership, a former judge, attorneys, medical legal partnership directors, and legal researchers, among others. And you can see this full list of key informants in the appendix of the brief that has been dropped into the chat box. And I just want to echo Bethany and extend a huge thank you to all of the key informants who participated. They really provided us with truly a wealth of information and ideas and recommendations that we tried to squeeze into this one brief, but could certainly write many more just based on what they provided. We also reviewed existing literature, including both peer-reviewed and white literature and web-based resources. So checking out what other programs are doing, looking at evaluation reports, things like that. And you can go to the next slide. So I'm going to get us started by talking about a few of the recommendations and then hand it off to Dr. Teufel. And just a note that we're presenting the recommendations today slightly out of the order that they're presented in the brief. We wanted to eliminate jumping back and forth in terms of speakers to make it easier for you all. And I also just want to mention that the recommendations we're discussing today cover a lot of ground. So in order to keep this webinar to only 90 minutes, we're going to be discussing them at a pretty high level. That being said, we welcome questions throughout the presentation and at the end, and definitely welcome the opportunity to do a deeper dive in the future. And we can go to the next slide. The first recommendation is increase access to evidence-based treatment for mental health and substance use conditions among people at risk of justice system involvement. Much of the work that I do is focused on improving the health of people who use drugs and people with substance use disorders. And as Bethany just described, it's incredibly challenging to access evidence-based treatment, particularly for people with substance use disorders, but also for people with mental health conditions. When focusing in on people who are involved in the criminal legal system, the gap between those who need treatment and those who receive treatment grows much, much wider. So for example, in 2021, only 3.6% of people who were incarcerated who had an opioid use disorder received buprenorphine treatment, and buprenorphine treatment is one of the gold standard treatments for opioid use disorder. We also know that criminal legal system involvement leads to worsened behavioral health outcomes, including increased risk of suicide, overdose and overdose death, something that we're facing at unprecedented rates right now in our country, and poor mental health outcomes. And that's why it's critically important that we try to keep folks out of the criminal legal system and instead connect them to community-based care. And community health centers play a vital role in that. There are many factors at the individual, organizational, and systems levels that contribute to barriers to access to evidence-based medications for people with behavioral health conditions. And one prevailing theme that emerged across our interviews, and that is also supported in existing literature, is the impact that persistent stigma and myths have on accessing evidence-based treatment for opioid use disorder, including methadone and buprenorphine. And we can go to the next slide. So through our information gathering, we heard many quotes similar as this one. The courts don't necessarily understand what Suboxone, which is a form of buprenorphine, or medication-assisted treatment is, and they think sometimes people can be weaned off of it. And there's an expectation that you're on Suboxone for 6 months and then you're going to be off of it. There is a fundamental misunderstanding among court officials sometimes about how evidence-based medications for behavioral health conditions work, particularly related to opioid use disorder. And these misperceptions have real consequences for people participating in court-ordered treatment programs or for people who return to use, for example, which we know is a very common part of recovery. We can go to the next slide. I know this is hard to see. It is in the brief. I just want to highlight it on the slide for you to check out later. From a health center perspective, I think organizations can learn a lot from this example, which is a lifespan transitions clinic in Rhode Island and the practices that they put in place. The Transitions Clinic has embedded community health workers who have lived experience of criminal legal system involvement to help people who have been recently incarcerated improve their health by navigating legal and social systems, in addition to receiving health care at the clinic. And one practice that has been really beneficial to the clients they serve is training medical professionals, so both students and licensed medical professionals, to educate judges and attorneys on mental health conditions and substance use disorders, including how to help overcome these myths and the stigma related to the use of evidence-based medications for opioid use disorder. And one thing that I think was really striking in this example and talking to folks at this clinic was the education and training and bidirectional exchange of information across the multidisciplinary team. So for example, the ways in which the community health worker was really able to educate the physician and sort of changing those power dynamics that are typical in, that are more often seen in more typical healthcare settings. And you can go to the next slide. And I think this quote just really illustrates the impact that this practice has had. What's been really helpful is that they had the doctor from the Transitions Clinic who's treating a patient who is being prescribed Suboxone through them, and they're still testing positive, and they come to the court, and the court is aware that they've tested positive. But the doctor send a letter educating the court on the person's medical issues and on the person's opioid use disorder, and recommending that the person be referred and continue in treatment. So the folks who are working in this clinic are really seeing tangible outcomes related to this approach. They see that judges and other court officials have really changed the way that they respond to folks who appear before them, and the way in which they think about what an appropriate course of action should be, and maybe it should be less punitive and more related to community-based treatment. And we can go to the next slide. The second recommendation that I'm going to talk about is to implement medical legal partnerships and more broadly health justice partnerships to increase access to legal services through collaborations with community-based healthcare providers. While I focused on the criminal legal system in the first recommendation, I want to talk a little bit about the civil justice system now, but my colleague, Dr. Teufel, is going to take a much deeper dive into this a little later. Folks who are joining us today and are already involved in medical legal partnerships most likely understand that law, both criminal and civil, is a very powerful determinant that impacts health at the individual and population levels. However, in the United States, access to civil legal services is very, very limited. In fact, according to the 2021 World Justice Forum Rule of Law Index, something that only a person like Dr. Teufel would be well versed in, the US ranks 126 out of 139 countries on the measure of civil justice accessibility and affordability. So that's pretty bad. Approximately 66% of people in the US will experience at least one legal need within 2 years, and the health consequences of experiencing unmet legal needs include negative emotions, negative impacts on mental health, and negative influences on physical health. Next slide. And I think this key informant quote really illustrates what a person with unmet legal and social needs and behavioral health needs may be facing when they try to access care that is already limited. They come in a federally qualified health center because they don't have health insurance. They get treatment there by a therapist or a psychiatrist, but it's erratic. It's not like they have regular transportation or regular housing, and they're able to make their appointments every Tuesday at 2, like someone who doesn't have those same concerns. Next slide. There are multiple pathways in which legal determinants can influence health, and in this brief, 4 are identified. So public health law, access to medical care, legal regulatory reform, and access to innovative legal services. Dr. Teufel is going to discuss some of these in more depth, but I want to point out that community health centers and courts have a role to play within each one of these pathways. Next slide. And one model that would fall under innovative legal services is the medical legal partnership model. And one direct way that community health centers can start to identify and address unmet legal needs is by adopting the iHelp screening developed by the National Center for Medical Legal Partnership. And iHelp stands for Common Legal Issues Experienced by Community Health Center Patients and includes income, housing and utilities, education and employment, legal and immigration status, and personal and family stability. And over time, this iHelp screening form has been implemented and adopted and adapted to meet individual clinics' needs. So if any folks are interested in seeing variations on this, feel free to reach out to any one of us. Next slide. Another great example for community health centers is the work that's being done at Philadelphia Legal Assistance in Pennsylvania. Philadelphia Legal Assistance has embedded attorneys and paralegals within federally qualified health centers and city health centers that specialize in treating people with opioid use disorder and co-occurring mental health conditions and other substance use disorders. The attorneys and healthcare providers have worked together to really increase their knowledge and advocacy capacity and the way they work with judges, probation officers, and other correctional staff to help them understand an individual client's specific behavioral health condition and the appropriate treatment for it. And I think the embedding of attorneys and legal staff within clinics that specialize in treating certain disorders really adds something to the field of MLPs, because there's really specialized knowledge that's happening, not just in the sense of a healthcare provider learning from an attorney how to advocate for a client, but really the reverse. So when we talk to folks at Philadelphia Legal Assistance, one thing we heard was the ways in which attorneys learned quite quickly about what substance use disorders are like for people who have them, what are evidence-based treatment and medications, and the ways in which they challenge their own stigma and misperceptions that they weren't even cognizant of having before engaging in this type of work. Next slide. The next recommendation is to improve policies and procedures that negatively impact the health and wellness of people with mental health and substance use challenges involved in the justice systems. And again, you could tell I love quotes. I think this key informant quote really captures the disconnect between what sometimes happens in a courtroom and with court orders and the reality of what people with behavioral health conditions face in the community. I don't think there's a full understanding of the brokenness of our system for mental health and substance use disorder services. They, the judges, just tell people to do things or accomplish things, or they write it into orders without a full understanding of how difficult it is, especially with housing and transportation issues and a lack of resources and other barriers. And again, this was a recurring theme, the idea that the perception of access to treatment in the community and resources and the ways in which folks can engage in recovery from a court's perspective was very, very different from what folks actually in that situation experience in their communities. Next slide. And when we were talking with key informants, many issues and recommendations related to policies and procedures were identified. Just a few are listed here. That legal and medical approaches need further integration to improve behavioral health outcomes, and courts should be included in the MLP framework. And this is one way to break down that disconnect of what community-based care and access to care looks like versus what the perception is in the courtroom. And again, there needs to be more focus on community supports for behavioral health before they become legal issues. One topic that I don't have time to do a deep dive into today, but I did add to the resources at the end of the presentation, is on deflection and pre-arrest diversion. And community health centers and courts play a very critical role in those models. So just recommend folks check out those resources. The importance of integrating trauma-informed practices and policies was heard throughout our interviews. Not even, fully implementing a trauma-informed approach, but just recognizing trauma exists and the impacts that it has on people. So just starting at the very first step of reconciling with what trauma does to folks and the impacts it has. And that justice system should aim to disrupt the vicious cycle as opposed to accelerate or add to it. And Dr. Teufel, I believe, is going to talk a little bit more about that in a minute. Next slide. And now turning to my colleagues who work with court systems, one recommendation related to policies and procedures that came up several times in our interviews is the need to simplify processes and procedures related to just appearing in court and navigating court. Thinking about how confusing it is for any person who is appearing in court for the first time, let alone someone who might have experienced significant trauma or maybe facing behavioral health needs, or is appearing in court because a fundamental right might be taken away from them. You can imagine how confusing, intimidating, and overwhelming it is to even enter a building and just try to figure out where you need to go when there's a lack of signage and clear direction. So we heard several times just simple changes such as creating easy to understand directions and signage were really important factors to helping folks with behavioral health issues navigate court systems. And for attorneys, just really taking the time to counsel your clients about what the courtroom will look like, expected etiquette, where the person should sit, who else will be present. Some of those basics seem to really go a long way to help folks. And one great example of how to make courts more friendly is the Red Hook Community Justice Center. So that is the images on the slide here. And these photographs are just a few examples of how they updated their signage to make it more friendly to people. And there's a great brief, it's linked on this slide, that talks about the work that they did at Red Hook. And next slide. And the final recommendation that I'm covering is explore further integration of and partnerships between federally qualified health centers and certified community behavioral health clinics as appropriate to the continuum of care. And also thinking about how we can leverage those partnerships to build better connections to justice systems. So again, a quote to sort of illustrate this need. Someone had a great idea. What would be most helpful is having treatment providers here in the courthouse or across the street. A big problem is that we have a population that doesn't get around easy, needs hand-holding, and needs a warm handoff. Next slide. So some of the high-level recommendations that were related to this topic are that health center patients who engage in enabling services are more likely to engage in primary care and to report better patient satisfaction. So again, really thinking about what you can do to increase the services that you provide that are related to addressing those social and legal needs. That courts are a key behavioral health referral source, and there's a need to integrate more behavioral health expertise and evidence into courts. I talked a little bit about that and the ways in which MLPs are doing education with judges and courts. Certainly Health Center and CCBHC staff play a huge role in that as well. And the last finding is this indirect pathway from courts to community health centers through certified community behavioral health clinics. And we can go to the next slide. I'm out of time, so I'm going to go over this very briefly, but the Ccbhc model, I keep calling it a new model, but it's been around for several years now. It can be thought of as the SQHC for folks who have behavioral health needs. And the map here just shows that currently there are more than 450 CCBHCs in the US. And you can see the distribution based on your site. They've really grown over time. I'll go to the next slide. What makes the CCBHC and health center partnership really important when we think about people who are involved in the justice system or at risk of justice system involvement is that CCBHCs have a required set of services that they must deliver based on the way that CCBHCs are financed. So these include screening, assessment, diagnosis, patient-centered treatment planning, outpatient mental health and substance use disorder services, crisis intervention services, and those services must be provided directly. And then there's a set of services that must be delivered either directly or through a collaborating organization. So peer support, psychiatric rehab, targeted case management, primary health screening and monitoring, which is an excellent opportunity for collaboration with community health centers, meeting the needs around primary health screening and monitoring, and armed forces and veteran services. Because of the ways that CCBHCs are structured, the population who they're reaching, and the services they must provide, CCBHCs have done a really good job of partnering with justice systems, correctional institutions, to create better pathways for folks who are in the justice system or at risk of justice system involvement and have behavioral health needs. So you can see here just a breakdown of the percentage of CCBHCs who have formal and informal relationships with justice system partnerships, and it is quite high. It's over 50% for juvenile justice agencies, adult criminal justice agencies and courts, mental health and drug courts, and law enforcement. So there's a really great opportunity to leverage partnership between CCBHCs and community health centers to develop these pathways for folks. And I'm going to end there and hand it off to Dr. Teufel. Thank you.
Great, thank you, Shannon. Bethany, are there any questions that you want to address now, or should I go?
Not yet. There was one question, but we're answering it right now in the Q&A. Thanks, James.
Great, thank you, Bethany. So what I'm going to start with is recommendation 3. And what recommendation 3 focuses on is this idea of recognition from court-focused organizations. So there is some history, some experience in MLPs engaging in this type of approach and trying to get recognition from courts. In this case, using Rutgers and Camden Coalition's medical legal partnership, they had a focus on fines and fees as it relates to courts, and looking at some of the inequities that occur with regard to fines and fees and how that affects people's lives. And that simple change, that idea of incorporating, in this case, medical and health policy experts in engaging the legal system in a partnership, is a bit of an innovation in the medical legal partnership world. So I've been involved with medical legal partnerships for approaching 20 years. And this is a new concept. So if we could go to the next slide, if we look at how typically medical legal partnerships have been conceived of in the United States, a lot of the focus traditionally has been on how can we link legal service providers, legal aid, law schools, pro bono, to medical organizations, community health centers, clinics, and hospitals. That was a lot of the focus for MLP for a very long time. So this Camden Coalition and Rutgers MLP experience is a bit of a different approach. So one of the questions is, what about medical people approaching the legal sector differently, beyond just legal service providers? And what about MLPs in general, focusing on other stakeholders in the justice sector? So if we go to the next slide. By only focusing on engaging legal assistance, so legal aid, pro bono, law schools, or court fines and fees, there tend to be things that we miss in that focus, right? We're missing key stakeholders and decision makers in the justice system. As examples, we're missing courts and judges and justices and clerks. We're also missing administrators within agencies, right? So Social Security, other places like that. When we miss, in this case, state courts and some of the stakeholders there, one of the impacts of that is we're also missing a key discussion point on how law can be practiced and who can practice law and when and where within states, because that's largely regulated by state courts that delegate that responsibility to state bars. In addition to that, when we tend to say fines and fees, in courts generally, I think that what that elicits in people sometimes is a thought of, it's something about criminal law, it's something about municipal or traffic citations, and that's certainly true. But I think we can look more broadly than that. And it isn't to dissuade people to engage, if they want to engage with courts on fines and fees, that's perfectly fine and reasonable. But there are other things that you can look at as well. So if we could go to the next slide. We know that MLP has been recognized by the American Bar Association for about 15 years, give or take. But medical legal partnerships could aim to engage other justice or court-focused organizations. There's a list here of National Center for State Courts. The justice sector, if you're not as familiar with that and you're more of a health person, as is a bunch of my history, health people love acronyms, so do the justice people, right? So they won't say National Center for Courts, State Courts, they'll say NCSC. They won't say things like Conference of State Court Administrators and Conference of Chief Justices, they'll say CCbhc. So if engaging the American Bar Association is certainly a reasonable strategy, engaging state bar associations is a reasonable strategy, but we can look to other justice-focused organizations as well, because they get to other stakeholders on the justice side. For me, my eyes were open to this idea when I was in Australia. Our more myopic focus on, say, physicians and lawyers, when Australia translated medical legal partnerships to health justice partnerships, they had a much broader vision of who fell into that health bucket and who fell into the justice bucket. If we go to the next slide. So Shannon spoke to this already to some degree, and some of this information is found in a study that I call the 10,000 Voices study. That's what I call it, because that's what I could remember. But the image of the study is here. It was recently released, Justice Needs and Satisfaction in the United States of America 2021, Legal Problems in Daily Life. That's why I call it the 10,000 Voices study, because I can remember that. I can't remember this whole study. But what this study found was something really important. What it found was that if you're looking at impacts of justice on people, what the primary impacts of justice on people are largely behavioral health, right? Emotional well-being, mental health. In other studies, they looked at, people have looked at other things of just generally negative health outcomes or substance use. Those issues also increase as people experience justice events. But the problem of a lot of people in the United States and the world generally is that most people do nothing, or they try to resolve these problems on their own. And when they do reach out to other people for help, the people they tend to reach out to are the trusted sources in their lives, and those people tend to be friends and family. And personal recommendations for who you should get help from, or when and how and where and all that stuff is really, really important for people. So if we're not engaging people through their trusted sources, then they tend not to engage in the justice system. If we could go to the next slide. So Shannon said that I guess I'm the person who likes slides like this. So the World Justice Forum puts out a rule of law index for the last 7 or 8 years or so. And there's some interesting findings from that rule of law index that Shannon highlighted, I'll highlight again. So we know that the United States performs nowhere near other high income countries with regard to access and affordability to civil justice. So Shannon gave the stat, it's 126 out of 139 countries in the world. But if you look at that and you break it down by income rank, right? We're a high income country. We're one of the highest income countries, depending on how we're talking about that in the world. We're last, not even close. And if you want to put that into context, some of the countries that we fall beneath with regard to access and affordability to civil justice are countries like Ethiopia, right? So countries that we wouldn't ordinarily consider our peers economically are our superiors with regard to access and affordability to, in this case, of civil justice. When we look at another metric that people get concerned about, it's, in this case, civil justice and discrimination. What we see is, again, we're not ranked very well, right? We are not last with regard to our income rank of high income countries. There is one country below us. So if you're ever on Jeopardy and that comes up and it's a daily double or something, the country that is below us with regard to discrimination in high income countries is Hungary. But if you look more closely at this chart, what you can see is sometimes ranks are deceptive, right? So we're not ranked well in either one. But if you look at our score on these things, we have way more room to grow in discrimination than we do in access and affordability to civil justice. So if we go to the next slide. So if civil justice and the justice events of people, which are largely civil justice experiences of people, impacts behavioral health significantly, and we have remarkable discrimination and we have remarkable access problems in civil justice in this country, one of the issues is what can we do, right? How can we intercept these issues, right? So if the issues are present in the world, if the problems are present, what can we do? And we know that a very few people are satisfied with regard to how their justice issue plays out. But when we look at the game changers in the world, how can we do this better? It seems that community justice services, doing things more simply, like Shannon mentioned, putting up signs in courts, basic wayfinding for people is really important. We need to deliver justice more close to where people are, right? So if you're familiar with the social determinants of health language, the old school language of where people live, work, and play, it's a similar idea for justice. If we want to deliver justice, it's a similar idea. We need to embed it closer to people. And we need to engage with people both through formal institutions and informal mechanisms of justice better to help people and to hopefully decrease this chasm with regard to justice. Next slide, please. So I'm not going through all of this slide, but what this slide gets at is in the criminal justice system, they're accepting the idea of this sequential intercept model. And one of the innovations in the sequential intercept model is we recognize that criminal justice system issues end up in courts. But in order to address those issues better, they have to somehow engage the community better, either on the front end for prevention, on the back end in monitoring, or creating intermediaries to help people get back to the community more effectively. That idea of the sequential intercept model can be mapped onto civil justice issues. The same issues we're recognizing in criminal justice, that courts play a role, and that role is important. But we also have to figure out how to engage communities with regard to justice. It occurs in civil justice as well. If we could go to the next slide. Great. So one of the opportunities, and I think community health centers play an important role in potentially educating the courts on these types of concepts, is including people with behavioral health issues and who have lived experiences with that in all sorts of levels of decision making. So community health centers, as not only an ideal, but as a policy, require that patient consumers make up the majority of a board. In court systems, the courts are supposed to be responsive to the people, but it may be that some of those people are not represented in their voices or their presence on some of these issues as well as they could be in courts. Community health centers could potentially voice how that's a possibility, and that the sky will not fall, and how it improves the care that you provide to people. It could also help courts better engage people and how they engage in justice and also the behavioral health issues that present within courts. We could go to the next slide. So Shannon mentioned this, and this idea, I think, is apparent to a lot of people, but sometimes it's broken apart, right? Sometimes people give the slide of criminal justice, people are overly represented if they have behavioral health issues in the criminal justice system. That's certainly true. However, what we also know is there are vicious cycles not only in the criminal justice system, but in the civil justice system, right? Where the issues of people, behavioral health issues, lead them to justice events. Those justice events create more sort of mental, emotional issues among people, and it creates another vicious cycle. So this vicious cycle is not solely owned by the criminal justice world. It also occurs within the civil justice system. Great, next slide. So one of the things in recommendation 7 that we're trying to get at is, and Shannon mentioned this idea, is navigation, right? So in the justice world, they're looking at court navigators as innovations. In the health world, we're also looking at navigators as innovations. One of the questions is, could we train a justice navigator, or to have some health experience, right? But more importantly, could we also look at community health workers and co-train them to help people better navigate some of the basics of legal information and also the justice system? We know that if we look at community navigators or courtroom navigators, that research supports they're competent and effective if they're engaged in simple procedural work. We know that consumers are satisfied with the experiences that they receive from community navigators or courtroom navigators. And this could be a really nice opportunity to engage in co-training, both on a legal side and a health side for community health workers as one example. Why navigation is in part important is that it helps to empower people. And we know that empowering people improves the health of people. There's a lot of research to support that as a concept. If we go to the next slide. As recommendation 8 gets at, and I'll go through this briefly, there's again a lot of similarity in the health sector and the justice sector. So not only is it just discussing these navigators similarly in both those areas and bringing them together, we need to develop better partnerships, intersectoral and interdisciplinary partnerships, because there are these themes in both the health sector and justice sector of convening, collaborating, partnering, and navigating. And right now, that's a particular interest for courts, is how can they act as a convener to better understand these issues. And so courts want to convene people to better understand how they can help the people, their stakeholders. And what would happen if there was better convening of people who knew how to address these issues was we would come up with a whole lot of very simple wins, basic wayfinding strategies. We also know that people typically want just simple advice. They don't necessarily need representation all the time, but people aren't getting that simple advice to navigate the justice system as well as they could. Go to the next slide. Great. When speaking with our key informants, one thing that they reminded us a lot was this idea of, when we talk about courts, people only think about judges. But it's not just judges. We need to think about court clerks. We need to think about administrators. We need to think about other court staff, not just judges. So certainly it's important to speak with judges, but judges are not the only key stakeholders within courts. We need to diversify the groups of people we're talking with. We can sort of engage in various practices that people find effective, right? So if we are working with judges, we can create bench cards, right? Bench cards, the idea is it's rules of thumb of how you address issues when they present in the court. And we know the idea of checklists or decision rules are really important to decision making. So Atul Gawande popularized that in the health world with Checklist Manifesto. But this idea of coming up with the key elements of how to address a person who's presenting with a behavioral health issue in the courtroom are really important, and they would help judges and other court staff better navigate those issues if they knew how to, through evidence-based, support the basics with regard to interacting with people who are presenting with issues at the time. Next slide. Great. And the last thing that I'll speak about briefly, and all of these things could be a brief in and of themselves, is the idea of regulatory reform. So we know that with regard to legal services, we have a chasm with regard to legal services in this country. We know that the number of lawyers has increased threefold. We know the number of lawyers engaged in the public interest has maintained at about the same rate over the last 3 or 4 decades, right? So we need to figure out a way that we can diversify our legal services workforce. Not all legal services are falling under legal advice or the practice of law as people would conceive. Some of it is, but we need to conceive of how we can diversify the legal services workforce to better deliver legal services to people at their time of need in close proximity to them. And what we know is lawyers are really good at the top of the license stuff, right? When it's a really complex issue, when it's substantive law, lawyers are really good at that. The lawyers are good at challenging judges and courts. Non-lawyers are really good at a lot of the procedural stuff and relating to the people and the consumers outside of courts. So we can figure out ways to best align that workforce to people and make it effective. Next slide, please. Great. So I have 2 more slides and then I'm done. So why is this important? When we look at research and we try to understand how legal work is sort of presented to the world when people come for help on a legal need, what we know is that lawyers acting as lawyers, meaning doing the work that lawyers are regulated to do, right? That the thing that makes lawyers special is lawyers spend a whole lot of their time acting as non-lawyers. We also know that non-lawyers spend a whole lot of time helping people with legal needs as non-lawyers. So we need to figure out not only how to regulate this space, right, from what roles are allowable, we also probably need to reimagine how we regulate this space, because a whole lot of legal services are being provided by non-lawyers. And we also know that a whole lot of non-lawyer services are being provided by lawyers, right, in a way that isn't necessarily regulated by traditional practice of law. Next slide. And this is just to reiterate the point. If we wanted to simply get rid of legal deserts in this country, not completely close the chasm of access to justice, we would probably need to more than double the legal service providers in this country that are focused on people law, right, that public interest law, in order to just simply eliminate legal deserts, right? Not close the chasm in total, but eliminate legal deserts. So that's all I have for today. I apologize for cramming so much stuff in, but it's a lot of stuff. I think it's important. I'm happy to answer any questions later. Thank you.
Thanks, Shannon. Thanks, James. Patty, we're going to roll right into your part of the presentation. Thank you.
Please, next slide. Next slide. Let's just get right to it. What I'd like to do and just share with you in the next couple of minutes is the background and history and resources and recommendations of the National Judicial Task Force to examine the state court's response. And then to really review the task force support for and really endorsement of the recommendations that have been discussed today, and to share with you how well they align, frankly, going forward, and what you can do to get started and what we can do to really continue the conversation on a national and state-by-state level. So right to it, National Judicial Task Force was appointed back in 2020, exactly at the time of the national pandemic. Note to self, never start a national task force at the same time as a national pandemic. But their goal was to assist state courts in their efforts to more effectively respond to the needs of court-involved individuals with serious mental illness. The task force is only the third in the history of the Conference of Chief Justices. It was led by 4 Chief Justices and 4 state court administrators, and another, I'd say, 35 multidisciplinary practitioners, whether it's psychiatrists, judges, lawyers, behavioral health providers, court managers, court clerks, etc. And this group met for over the last 3 years, and it resolved into its work or culminated in its work this summer with the Conference of Chief Justices and the Conference of State Court Administrators. And so next slide, please. This summer, all Chief Justices and all State Court Administrators considered the findings and recommendations of the task force. They reviewed all of the resources and materials, and there are a number of key findings and recommendations that we wanted to highlight for you today. We know that individuals with behavioral health needs are overrepresented. This statistic is in the criminal justice area, but we know, and you know, that behavioral health and serious mental illness impacts all court dockets, whether it's criminal justice, civil proceedings, juvenile justice proceedings, child welfare, domestic relations, all court dockets. But one of the key recommendations, among many recommendations, is that courts must partner with so many individuals and agencies and entities. And the encouragement is to partner not only on a statewide basis, but also each and every community. We face our work not only nationally, but state by state and community by community to accomplish the necessary changes going forward. Next slide. So I mentioned that all Chief Justices and State Court Administrators, and I would note unanimously adopted what's called Resolution 1. And I know Resolution 1 is included in your materials, but it's worth highlighting for you. Basically 4 recommendations that courts must lead this effort to improve access to treatment, to improve the way that we are addressing the needs of individuals with mental health and behavioral health needs. That we recommended, and the courts and the chiefs and the state court administrators agreed to create and support state-level interbranch mental health task forces, and to encourage and support local judges in the creation of their partnerships in their regional or local, whether it's task forces or groups or committees, but that this work has to be done state by state and community by community. They also recommended that all of the resources be examined, and using the recommended models and resources, the Chief Justices and State Court Administrators asked that each state court and each community undertake that assessment and use that convening power, use the convening power of local judges as well as state court leaders to bring together the partners, to bring together community members with disparate views and disparate voices to better understand what and how we can make improvements in our response to individuals with mental illness and other behavioral health disorders. The third recommendation was education. We needed to do a much better job of educating our judges and court personnel and stakeholders on the needs of individuals with behavioral health conditions, to really understand the prevalence of mental illness and substance use disorders and co-occurring disorders, and to understand better through bench cards and other tools what could be done to better respond in the courtroom, but also how to design systems in the community that could better serve individuals with behavioral health needs. Finally, to advocate. We must advocate for public health response to individuals with serious mental illness. rather than the current criminal justice response. So often law enforcement have no alternatives but jail or on occasion an emergency room. We have to have other alternatives in our community so that we can respond, all of us can respond better with a public health model and not the criminal justice system that we so often see. So let's go to the next slide. Thank you. So where do we start? I think there are a number of recommendations and places to begin. We need to think individually. So each of you on this call and others across the nation, I would start with understanding how the recommendations through this report are perfectly aligned with the recommendations of the National Judicial Task Force. So I would become acquainted with the resources and recommendations you have. That's a good starting place. Number two, after you do that, I would sign up for both the Medical Legal Partnership newsletter as well as the court's behavioral health alerts, and make sure that you're receiving periodic updates on the status of task force activities. Number three, I would contact your local presiding judge and or trial court administrator and introduce yourself, set up a meeting, introduce yourself, and offer to help and discuss what opportunities may exist in your community. Think about your recommendations that are included here. Think about the recommendations that are included in the task force area and where you could contribute, whether it's to first convening, whether it's to embedding a clinician or a health service worker into the courts, whatever your idea is, make that offer. I've been working with courts and communities for many, many years, and I am always looking for additional help, support, ideas, and contributions. I think we have an opportunity to partner with courts. And if you don't know your local court administrator or presiding judge, let me know. I'll find out for you and we'll make that connection for you. I think it's also important for us to think nationally as well as state by state. And to the extent we are just now beginning what I call implementation. The task force is developing a report of all of its recommendations coming off of this summer's meeting and adoption of Resolution 1. And we will be then moving toward implementation. I think we're at the starting line of making a real difference. And each of us have a responsibility to use these recommendations that align so perfectly with going forward. And so we're at the start line, and I think we can, again, get going, get started, and make a difference. And those relationships will build. You could offer one thing at the beginning and it will soon blossom within that community. If we have another minute or two, do you want me? I could just briefly talk about how these messages are aligning, how the recommendations are aligning.
Yes, thanks, Patty.
Okay, thank you. Certified community behavioral health clinics were mentioned. There is a lot of federal money coming through those clinics. We're going to see a lot more clinics. So that's a wonderful opportunity. Judges are conveners. Again, those recommendations align perfectly, both sets of recommendations. working with peers and individuals with lived experience align perfectly. Behavioral health positions in courts align perfectly. Partnerships, training, education, working on improving trauma-informed practices align perfectly. Again, the task force endorsed the 9 recommendations of this work today, and there are so many opportunities before us. So thank you for participating in this webinar, and I'll turn it to Bethany for questions and answers.
Thank you so much, Patty. We greatly appreciate you taking time to represent what the task force worked on, and for also supporting this effort. For Shannon and James, this is a pretty heavy lift to think about MLP in this, working in this way by expanding to bring services to the court and the justice system, thinking about it in a broader way. So before we go into additional Q&A from the audience, James and Shannon, could I ask if you have additional tips for the audience on where to start?
I can go ahead. I think from a really practical and practice-based perspective in thinking about this work and how complex and nuanced behavioral health is, and the added challenge of the stigma and myth that we face each day related to these topics. One recommendation that I would make to MLPs is to make sure that at every stage of your planning, implementation, evaluation, thinking about how to do this work, that you are involving people with lived experience. And to the extent that you can, include people with lived experience on your teams, in leadership positions. Really, every community is different. So having folks with lived experience who have actually tried to navigate care systems and justice systems in your community is going to be the best source of information and education for your team.
And what I advocate is, typically to make change happen is you need some sort of champion in whatever organization you're walking into, right? So if you have champions within your state bar who would support your initiative, and you can find champions within your state courts, either at a Supreme Court level or another judge level, and given the powers that they may have, maybe a little different, that's what I would consider. One thing I would say to avoid is when you don't have, if you need, say, 3 key champions to maybe make something work and none of them support you, it's maybe not time for that idea, and move on to another one, because your time is limited, your time is valuable, and focus on the movable, winnable strategies, and not those things that will eat your limited time and you'll feel deflated from it. What I can say is that's what I see works, right? It's about not only the idea, but the people in places. And if those things align in shared value, that's where I spend my time. I don't spend time in trying to alter many powerful people's attitudes at extreme levels if they're completely opposed.
That can be frustrating, James, completely understand. Thank you, James and Shannon. I want to see if the audience has questions. Also, I want to note that in just a moment here, the audience will see an article shared by one of the audience members, Dr. Keisha Cogdell in New Jersey, who's a nurse, and helped to highlight the role that nurses play, the pivotal role that they play within a justice system. It also provides me with an opportunity to, thank the nurses that have been leading some medical legal partnerships, nurse-led partnerships in places like Philadelphia, and our partners in the National Training and Technical Assistance space here, NNCC, have been highlighting some of that work. So we'll plug a link to that article so you can read more about how nurses in particular have been addressing the social determinants of health gap in the judicial system for vulnerable populations. And thank you, Dr. Cogdell, for sharing that in the link. And if folks have questions, you might want to DM her now, but we'll also be following up to see if we can specifically highlight her work and help to uplift those interests. So let's go to the Q&A. Do folks in the audience have additional questions for the audience? And I can also highlight a couple of questions that came in. I'll start there. If folks missed it in the Q&A, I know that one audience member, Margaret, did ask a little bit more about whether this panel is familiar with the panel that presented in our June webinar event on the Physician Public Defender Partnership. So we know that MLP has traditionally talk about addressing civil legal needs. So you have civil legal services providers partnering with healthcare. And what we did in June was highlight what has been, I think, beginning to pop up, develop, and flourish in certain communities, which is a more direct opportunity to address the needs of justice-involved populations, do that preventative legal advocacy. And so that team was from Rhode Island that presented in June, and we can plug a link to that webinar. And I want to venture to say, yes, absolutely yes, that James, Shannon, and Patty all know very well the folks in Rhode Island. That was on the slide deck that Shannon featured, the Rhode Island Transitions Clinic team. Shannon, do you want to share anything more about that Rhode Island Transitions Clinic? And James, I know you also know them and I think had spoken to them during the interviews.
Yeah, they were definitely included in this process. We talked to a couple folks from the Transitions Clinic, including the director of social services within the public defender's office and a community health worker who is in the Transitions Clinic itself, and just really remarkable model. Highly recommend checking them out. We did include that brief example from the field in the brief that we're discussing today, but there's now a growing body of information related to what they're doing. And I found that they're very responsive. If you shoot them a cold email or give them a call, they are very much interested, I think, in sharing their lessons learned with other folks.
Mm-hmm. Agreed. We received quite a few inquiries from folks who tuned into that June webinar and wanted to learn more about that partnership, or who let us know that they too were beginning to work more directly with public defender offices through their medical legal partnerships. Thanks for sharing that, Shannon. James, did you want to share anything more? Or Patty, do you have any thoughts on working directly with public defenders?
We made a number of recommendations or the task force made a number of recommendations about embedding social workers into public defender offices and really equip them with the necessary background knowledge and education to more proactively advocate for their clients with behavioral health needs. Those recommendations are included in the case flow management, person-centered justice resource. So again, we fully support, the task force fully supports those sorts of suggestions. Also had recommendations for prosecuting attorney offices and how they are setting up their own behavioral health offices and units and specializing in that area to make the best decisions for incidents that may occur. Is it a criminal justice incident, or is it a medical incident that could be redirected outside of the criminal justice system?
Great, thank you so much. And to everyone, the slide deck will be shared along with the recording on our website. So look forward to receiving the links to all of those resources, such as what Patty just noted. I want to get to a question that just came in through the Q&A. I'll read it out from the audience. We currently work with specialty dockets, drug courts, mental health courts, etc., in something less formal than an MLP, and would like to expand into one, but we struggle with courts trying to make treatment decisions from the bench that do not align with trauma-informed practices or do not respect patients' rights for confidentiality and providing services via the least restrictive alternative. Do you have resources or tips to help with the courts to provide education in a way that's approachable to the courts? Patty, can I start with you on this one?
Certainly.
Thank you.
The task force had, again, a great number of recommendations and really saw treatment courts as just one small part of the solution. I would recommend first that you look beyond treatment courts for the solutions going forward. We need to, the treatment courts will never meet the needs. I would, following James' advice, I would spend my time focusing on other opportunities, whether it's in the criminal justice or civil justice or juvenile justice area, and that would really come before a treatment court. For education, and what we have going forward for education is we're currently supporting the Judges and Psychiatrists Leadership Initiative adopted a plan with the task force to develop an expanded curriculum to offer that through a train the trainer approach so that every judge in every community in every state receives some basic new judge orientation training as well as more advanced training every few years on developments in prevalence and implications of substance use disorder, co-occurring disorders, and mental illness, to really focus on better responses in the courtroom itself. And as a third rung or piece of that education, what could be done differently in that judge's community, and what is the role of the judge in advancing those kinds of community efforts. So those would be my recommendations for proceeding. Bethany, I hope that is helpful and responsive to the question.
Absolutely. It's a great question. And thanks so much, Patty, for sharing those considerations, something that I think we even talked about as Shannon and James and April and folks were informing the issue brief. James, I saw you unmuting. Do you want to add to this? I know you do. It's will you.
I'll take up airspace. But so this is building on one thing that Patty was speaking to, right? One of the things which is interesting in comparing health and legal is that in health, we have all sorts of evidence-based programs or approaches that apply across all sorts of different jurisdictions, where we're not as good at scaling approaches in the legal world. But what we know is when people learn about what are the most important aspects of what needs to change, it crosses jurisdictions with some rare exceptions, right? And so one focus, one key area would be, how can we scale and sustain whatever these solutions are that people are seeing? What are the problems or what are the solutions across multiple jurisdictions? So it's not just stuck in this court or that court or this other court, because the solutions to the problems transcend jurisdiction. And to Patty's point, this problem-solving court approach, one of the struggles of it is people who have one problem are more likely to have multiple problems. And now you're sending them to different problem courts. And you're also in part defining people by their problem. And I think what we need to do is define people and communities and things as by the solutions better, and not bucket people by problems. I know that doesn't answer the question of the person answering the question. I apologize for that. But these are some of the things that I think are really interesting to think about in the legal world, which is different than health.
Agreed. And we saw, I just want to highlight and recognize, I think, the legal aid and medical legal partnership folks in the state of California in particular, who really came together on an advocacy effort to educate the policymakers on the care courts, right, and raise similar concerns in the state of California about starting or creating that sort of siloed and potentially stigmatized and punitive court system or separate system, right? And so, you know, for better or worse, I think the role that MLPs can play in patients of policy, there is an example of how you can use what you know about the patients and the client populations that you serve to raise those issues and provide education in a very specific way, right? Because the letters, the sign-ons that I saw in relation to that that care courts proposal initially, I think it went through. I'm sure it went. I'm positive that it actually went through. It provided education. There were absolutely like salient points made about the concerns that the civil legal services providers, healthcare providers, and MLPs coming together had about that. I don't see any other questions in our Q&A. But I do want to just recognize once again, let's go to the next slide, the role that medical legal partnerships, especially based at health centers, have played in really driving the content that we're able to deliver on these webinars, and let you all know that we have some more coming up, especially for those of you who are in today's audience who said you don't yet have an MLP. We have more coming up about how to build an MLP. So this particular webinar today was really designed to help advance medical legal partnerships in terms of their collaborations and approaches. But if you're at the very beginning stages, don't worry, we have content coming up on October 18th about how to develop those screenings, referrals, and service delivery workflows, and then how to train the workforce. You heard James, I believe, in his particular piece of today's presentation, talk about Legal Link and their legal first aid training for CHW. So tune in on November 1st so that you can hear from some very old classic veteran names, I won't give it away yet, in the MLP field about how to train that workforce. What are some promising practices out there to better meet the needs of providers and patients in medical legal partnerships? So tune in through our newsletter so that you can sign up for those webinars. Let's go to the next slide because we're closing out. Again, who you don't see on here is who really inspired, I think, this entire undertaking, and you'll hopefully be able to hear more from her, April Merrill from Legal Aid Services in Oklahoma. Please, thank you to April, even though she's not on. Thank you for inspiring this work. I also want to, again, thank Patty Tobias from NCSC. James Teufel has been a long-time Health Center MLP champion and researcher, and Shannon Mace, also a long-time MLP practitioner, also now leading a medical legal partnership, for the very heavy lift that went into interviewing in the field, thinking about this concept that we are looking at, which involves more collaborations, right? It's not easy work at all. And for those of you who are in our audience, maybe you were part of the key participants or interview informants group, thank you. And then those of you who are in the audience, thank you for joining us today, including those who asked questions, shared additional resources. We will see you all again very soon. Please download the issue brief, share the link so others can receive it, and don't hesitate to reach out to us at ncmlp@gwu.edu if you have any further questions or would like to reach out to Shannon Mace, James Teufel, Patty Tobias, or others in the field for support. Thank you all. Take good care of yourselves, and we'll see you next time. Thanks, everyone. Bye-bye.